Hello, coders. Good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome back to another CPT Guideline Mastery session here with AMCI. Thank you, Miss Mills, for letting me know that mic sounds good. Thank you. How are you all doing, coders? By the way, I love this intro song of ours, AMCI jingle. I love them. So, yes, so we are back with another session. Today actually marks week 8 of our second semester here at AMCI, and I hope you all had a great learning experience over the past 7 weeks of class. It has been wonderful having you all here with us throughout these sessions, and I sincerely appreciate everyone who have shared their feedback, who completed the survey form, and also actively engaged in the chat. So your engagement actually makes this session even more valuable for all of us. So who all are there here with us today? Let me look quickly into the chat. I can see hi Alanda, hi Lily May, hi SL Canvas, hi Becky, who else? Hi Erin, hi Catherine, hi Miss Catherine. So from our side I can see Miss Catherine is here, Miss Tyra is here, and Miss Mills as well. Okay, good. Type in the chat. Who all are here with us? Okay, so without wasting much time, let's go ahead and begin today's session. Let me read out the copyright. CPT Copyright 2026 American Medical Association All Right Reserved. CPC is a registered trademark of AAPC. AAPC content found within this presentation is a copyright of AAPC. The keyword concept FTR Chun AMCI Fab 7 AMCI ICD 10 Flip Tab and MCG are trademark of AMCI. The credentials CPCC, RCC, OC, CPM, ACPB, CPPM, CPCO are owned by AAPC, AMCI do not own right to these credentials. The credentials CCA, CCS, CCSP, RHI, RHIT are owned by AHIMA. AMCI do not own right to these credentials. Okay, so Chorus, before we begin today's session, just quick reminder, I would request you all to please take a moment to fill that survey form towards the end of the session and let us know how you feel about the session. And as always, we today also we have a great attendance, and I can see some good participation in the chat as well. But so please make sure you all fill out that survey form because your feedback really helps us to improve and bring better sessions to you all. And the best part is it takes less than a minute to complete. So please do fill out that survey form towards the end of the session. Okay, you can see hi Starry Sunny. Starry Sunny is here back. And April, hi. All right. So today we will be covering one of the most important and always highly demanded topic in the CPT coding, the evaluation and management chapter. So before we begin, I would like to mention this that this is not a beginner level session. And since this is a CPT guideline mastery session, the discussion here will be more advanced and focus in depth on the E&M concepts, E&M coding concepts. So, in today's class, we will primarily focus on the E&M level selection using the MDM table. We will review key definitions of the MDM elements, work through coding scenarios using our AMCI PDR chart. So, evaluation and management section, as you all know, is located at the beginning of your CPT manual, immediately after the introduction section and before the anesthesia chapter. And the codes usually ranges from 99202 through 99499, and we categorize them according to the type of the service provided and the setting in which the service is being performed. So some of the major categories included in the E&M sections are the office visit, the telemedicine, the hospital inpatient, and observation care. And we have a lot of them like consultation, emergency department, so and so. So each category contains its own specific guidelines and reporting instruction. So therefore, it is essential for you all to carefully review those chapter guidelines and make sure you apply them before selecting the codes as well. Hi, I'm Madhu. Hi, Lion. So I can see few coders are still joining. Few new coders are joining. Welcome, everyone. Now, let's quickly understand what an ENM or evaluation and management means. So even ENM refers to the service provided by physician or other qualified healthcare professional to evaluate patient's condition and manage their care. In simple terms, I can say ENM is your doctor visit, and it includes a component like a checking or a review of patient medical history, performing the physical examination, medical decision making, also known as MDM, ordering of diagnostic tests, medication. Sometimes it also includes the counseling and educating the patient as well. So today we are mainly focusing on how to solve the ENM using the MDM table. And one of the biggest questions which comes to our first question that comes to our mind is how do we select the correct ENM code? So to determine the appropriate ENM code, we need to answer few important questions. First one is to check whether there is a medically appropriate history and or exam, because without a history or an exam you cannot code an ENM visit. So make sure there's a medically appropriate history and or exam done. All right. Next thing to identify is the location of the visit. Example, whether the service was provided in a hospital, inpatient office, or emergency department, or in a nursing facility, because we have codes for separate codes for all those places. Okay. Next, we determine the type of the visit, whether it's a new patient or an established patient. All right. Sorry, coders, for that technical glitch. So let me share my screen once again. Hang in there. Okay, so we were. Are you able to hear me now? Please do let me know in the chat. So we were talking about to determine whether it's a new patient or a established patient. Are you able to hear me now, coders? Okay, thank you. So once you determine it's a new or an established patient, then we have to determine the ENM level. So ENM level can be determined. Thank you everyone for letting me know. So ENM level can be determined by two ways. One, you have to determine the total time. If a total time is documented, you can determine the level using the total time. Otherwise, you can determine the ENM level using the medical decision making. So, in medical decision making, if a medical decision making ENM is it's not clearly defined, then you will have to inventory and score. So, I will talk about them in a later stage. All right. So then you have to select the ENM codes from the ENM tables and apply all the guidelines. So let's go ahead and we will solve them one by one. Now, to adequately determine the level of the visit, the MDM is selected based on three components. As I said, one is your number and the complexity of the problem addressed. The second one is amount of and complexity of the data reviewed and analyzed. Third one is a risk of complication and morbidity or mortality of the patient management. Now, this table is the MDM table, and which using which you can solve the ENM scenario. So we have in our AMCI, we use a different chart, which is the same chart, by the way, but we have simplified it. And that chart is known as the PDR chart. So, as I said, since we know the MDM are evaluated based on these three categories, I will be referring these three items as PDR. P is stands for the problem, T stands for the data, and R stands for the overall risk. And this is how your PDR chart looks like, and you will find the PDR chart in your MCG manual. So if you have the MCG manual, AMCI MCG manual, you can find that AMCI PDR chart in them as well. All right. Now, another important thing you will need to know when scoring the medical decision making is understanding a few key definitions used in the CPT guidelines. So make sure you understand these definitions because they are very important for correct scoring of the MDM. Now we are looking at the number and the problems, number and the complexity of the problem addressed at the encounter. So under the problems, you will find all these elements. These are the elements which you are going to find under the problem. So then you have the definitions under the amount and complexity of the data reviewed, followed by the definitions under the risk of complication and morbidity and mortality of the patient management. Now, we will read through some of the definitions today in our class, but make sure, coders, after the session, you go to your CPT manual and you read all these definitions, okay? Because that is very, very important for you to nail those ENM leveling using the MDM table. Now, let's begin by doing some coding exercise. All right, so here is your first coding, and this is solving an ENM scenario using time. Okay, so let's solve it. Let's solve this one. What is the correct CPT code for this encounter? Option A 99203, option B 99204, option C 99205, option D 99214. A 42-year-old patient presents to the physician's office for the first time. Patient complains of persistent migraine headache occurring several times per week over the past 2 months. The patient has not received any professional service from this physician or another physician of the same specialty within past 3 years. Physician performs a medically appropriate history examination, uh, patients the reviews patient symptoms and prior treatment history, discuss the possible migraine triggers, and adjust the medication regimen, and provides counseling regarding lifestyle modification and follow-up care. Total physician spent on date of the encounter included both face-to-face and non-face-to-face activity related to the patient care. Total time spent on the date of encounter is 47 minutes. Coders, place your best answers in the chat. Go ahead, coders. So this is a time-based ENM scenarios. All you have to do is to identify the correct ENM code based on the total time spent. Okay, so let me have a look into the chat. No answer so far, so I'm still waiting. Go ahead. All right, that is time. So let me walk you through this one. And we have to answer a few of the questions. First one, was there a medically appropriate history and exam performed? Yes, it was done. How about the location? This is an office visit. Is it a new patient or an established patient? I would say this is a new patient because it's clearly documented that patient is visiting the physician office for the first time and he haven't visited the physician or another physician of the same specialty within past 3 years. So that qualifies for a new patient, right? Yes. Now, total time of the visit, yes. In our scenario, the total time is documented. So, by the way, option D is incorrect because that's coding for an established patient E&M visit, and total time is documented. So, all we have to do is to pick the correct CPT code based on the time. Now, you can see I have chunked the time in my CPT codes as well. So 99203 is when total time spent is 30 to 44 minutes. 99204 is when total time spent is 45 to 59. And 99205 is when total time spent is 60 to 74 minutes. And I know that the total time spent in this scenario is 47 minutes. So based on the time, the correct answer is going to be option B, 99204, right? Yes, I can see most of you have went for. Let's see, all the answers are on 99204. So great start. Let's move on. Let's do another scenario. Okay. What is the correct CPT code for this encounter? Option A 99204, option B 99213, option D 99214, option C 99203. A 58-year-old established patient presents to the cardiology office for follow-up management of hypertension and hyperlipidemia. The patient was previously evaluated by another cardiologist within same group practice approximately 1 year ago for similar cardiac related conditions. During the visit, physician performs medically appropriate history and examination, reviews recent laboratory results and blood pressure logs, adjusts patient's antihypertensive medication regimen, and discuss ongoing cardiovascular risk reduction and life modification. Encounter involves a moderate level medical decision making. What CPT code is coded for this encounter? Alright, coders, go ahead, place your best answers in the chat. Okay, that's time, and I can see only one alphabet or one CPT code in the chat, and that is 99214. Great job. So Again, asking the same question, was there a medically appropriate history or exam? Yes, it was performed. Location is also an office visit. Whether it's a new or established patient, yes, it is an established patient because patient was evaluated by another cardiologist within the same group practice approximately 1 year ago, right? Yes, and as per the guidelines, here we go. Guidelines also clearly state that an established patient is one who have received professional service from physician or other qualified healthcare professional or another physician or qualified healthcare professional of exact same specialty and subspecialty who belongs to same group of practice or group practice within past 3 years. So definitely this is an established patient. So option D is wrong. No need to look into it. Option A is also wrong. Between option B and C, we can see that we had a moderate level medical decision making, and 99213 is coding for a low level medical decision making, not a moderate level decision making, and 99214 is the one which is coding for a moderate level medical decision making. So absolutely right, you all are on the point. You all nailed this scenario. Excellent job. Let's move on to the next one. Exercise number 3. Based on the documentation, which code is most appropriate for this encounter? 99213, 211, 99212, 99213, 99214. A nurse visit is scheduled for patient with recent elevated blood pressure readings. Patient reports that the home PP readings over the past week have remained high despite compliance with the prescribed medication. And at today's visit, the patient's pressure recorded 154 per 88. Nurse discussed the reading with Dr. Smith, who decides not to adjust the medication regimen at this time. The patient is instructed to continue monitoring blood pressure at home daily and return in 1 week for another BP check. Based on this documentation, which code is the most appropriate for this encounter? All right, type your answers in the chat, goddess. You are going to rock this one as well. Okay, so from what I see great answers in the chat. So let me know, Codus, why have you selected, for those who have selected option A, why did you win with option A? Type in your answers in the chat. Okay, so yes, I would also straight away pick 99211 because if you read the code language for 99211, this is my reason. I can read that this is for an office or other outpatient visit for evaluation and management of an established patient that may not require presence of the physician or other qualified healthcare professional. So here it was just a nurse visit, right? There was no doctor. Doctor didn't visit the patient directly. Yes, definitely. Nurse did discuss the reading with the doctor, but doctor didn't visit this patient, so it qualifies for option A. That is for 99211, and that's the reason why I would pick option A as the correct answer. There you go, Starry Sunny. Excellent answer. Spot on. Yes, lady. Great answer. Great answer. Okay, no worries. Glad you're here. Okay, Curtis, you all have been doing a great job for the last three scenarios. Now we have completed one ENM scenario based on the time, another where MDM level was already defined. Now let's move on to the scenarios where neither the MDM nor the time is provided. So before we begin to solve those cases, let's first do some exercise to practice identifying the three key elements of the MDM, namely the problem, data, and risk. Okay, so first we will start with the problem. And the problem is actually the number and the complexity of the problem helps to identify the nature of the presenting problem and are based on the relative level of difficulty involved in making a diagnosis and managing the condition. So for a problem to be counted in number of problem addressed, it must be addressed during the encounter. So by simply listing a chronic illness is not sufficient. Okay, the provider documentation should clearly indicate that the condition was evaluated, assessed, and monitored as well as treated, otherwise managed during the encounter. Okay, so let's go ahead, and these are the elements which you will find under the problem, under the number and complexity of the problem addressed at the encounter. So you can see these elements, you can see how it's defined. What is a minimal problem? It's been defined there. What's a self limited or minor problem? What's a stable chronic illness? What's an acute uncomplicated illness or injury? What is an acute uncomplicated illness or injury requiring hospitalization? Subacute illness, stable acute illness, sorry, chronic illness with exacerbation, progression, or side effects, undiagnosed problem with uncertain prognosis, acute illness with systemic symptoms, acute complicated injury, chronic illness with severe exacerbation, progression, or side effect, acute chronic illness or injury that poses serious or poses a threat to life or body function. So these are the most common elements which you will find under the problem column. Okay, so please, after the session, once you're preparing for the ENM classes or you're preparing for the ENM session, please go ahead and read these definitions. All right, and this is a problem column from our PDR chart. So yes, you can see there are four levels. One is minimal. The first that if you have a self limiter or a minor problem, one self limiter or a minor problem, that qualifies for a minimal problem. Then if you have two or more self limiter or minor problem, or one stable chronic illness, or one acute uncomplicated illness, or one stable acute illness, or one acute uncomplicated illness or injury requiring hospitalization, hospital inpatient or observation level care, that will qualify for a low level problem. Then we have a moderate level problem, and you can see the conditions that is required to qualify for moderate level problem. And if your scenario ticks any of these box, you can select a problem as a moderate level problem. It's followed by high level problem as well. Okay, so this is from our PTR chart, and the other one you see over here, this is from your CPT manual. Okay, now let's do a scenario based, uh, not based, let's say do a scenario to pick the problem from this question. Okay, what is the most appropriate problem category? Option A, self limited or minor. Option B, acute uncomplicated illness or injury. Option C, stable chronic illness. Option D, undiagnosed new problem with uncertain prognosis. A 52-year-old patient presents with a newly discovered right breast lump. Noticed during self-examination. On exam, physician palpates a firm, non-mobile breast nodule. Due to concern of possible malignancy, the diagnostic mammogram and ultrasound are ordered. Patient is referred to breast specialist for further evaluation. What say you, coders? And you can place your answers in the chat. All right, I can see the answers and only one alphabet in the chat. Okay, Coders, go ahead, give your best answers. Those who haven't answered, please place your best answers in the chat. Yes, so these are the definitions of the different elements which we can find in the problem column. So let's go ahead and see. Is it a self-limited or minor problem? There was a newly discovered breast lump, right? A non-mobile breast nodule. So definitely it's not a self-limited or a minor problem. And you can see the definition. Self-limited or a minor problem is a problem that runs a definite and a prescribed course and transient in nature and is not likely to permanently alter the health status. So definitely it's not a self-limited or minor problem. Next question, is it a stable chronic illness? Again, I don't think this is a stable chronic illness as well. And is it an acute uncomplicated illness or injury requiring hospital inpatient or observation level? Well, let's look at the final option. And I think that's the most suitable because this is the scenario which qualifies for undiagnosed new problem with uncertain prognosis. And if you see the definition, you will have a better understanding. It's for a problem in the differential diagnosis that represent a condition likely to result in a high risk morbidity without treatment. And a breast nodule, you can see it's documented as well. It can be a malignant nodule as well, right? Yes, it can be a malignancy as well. So definitely, it's a newly undiagnosed problem with uncertain prognosis. So I also agree with you all. This is option T. Great answers. Let's go ahead. Let's do another one. Okay. A 58-year-old established patient, female patient, presents with a routine follow-up visit for stable type 2 diabetes mellitus diagnosed 8 years ago. She has been complained with metformin and dietary recommendation. Her blood sugar logs and recent HbA1c have remained within patient's physician's target range for past year. The patient denies dizziness, vision changes, numbness, or episodes of hypoglycemia. The physician examination is unremarkable. Physician reviews her laboratory results, determines that the patient diabetes remains stable and well controlled, and continues the current medication regimen any changes, without changes, and recommends ongoing diet and exercise. A follow-up appointment is scheduled for 4 months. Is this an acute uncomplicated illness, chronic illness with exacerbation or progression, or undiagnosed new problem with uncertain prognosis? Type your answers in the chat, coders. Okay, these are straightforward. Go ahead, type your answers. Yes, I can see a lot of V. It's great. It's great that everyone are on the same page. Okay, so I'm quickly stopping the watch because we have few more scenarios to cover today. Yes, so it's not. It's diabetes mellitus. Patients having a diabetes mellitus, and it's been documented that it's a stable diabetes mellitus, right? So diabetes is definitely a chronic condition. It's not an acute, uncomplicated illness or injury, and doctor has documented it's to be a stable and well controlled. So it's not an undiagnosed new problem because it's already diagnosed as a diabetes mellitus. It's not chronic illness with exacerbation. It is chronic illness, but there's no exacerbation, progression, or side effect of the treatment. And yes, you all are right. It is a stable chronic illness. Okay, so please go ahead and feel free to read this definition of what a stable chronic illness is. All right. Okay. Now, quickly move on to the next one. A 68-year-old established male patient presents to the emergency department with sudden onset of chest pain, severe shortness of breath, diaphoresis that began 1 hour prior to the arrival. Pain radiates to his left arm, jaw, and jaw. The patient has no coronary artery disease, hypertension, or diabetes mellitus. I believe that's a patient has no history of coronary artery disease, hypertension, and diabetes mellitus. On examination, patient appears distressed and pale. Blood pressure is 90/60, and heart rate is 180 bpm, and oxygen saturation is 89 on room air. An EKG and cardiac enzymes are ordered immediately, and physician initiate oxygen therapy and emergency cardiac management for acute myocardial infarction. Patient's condition best classified as. Okay, go ahead, Curtis. Give your best answers. All right. So most of you have went with option D. Okay. So the condition here is acute myocardial infarction. Otherwise, we call them it as a heart attack, right? And is it an acute, uncomplicated illness requiring hospital inpatient observation or level care? It's not an uncomplicated illness. Acute myocardial infarction is serious condition, right? It's a serious, very serious condition. It's not a chronic illness with severe exacerbation. It's not going to be acute illness with systemic symptom. It is acute or chronic illness with or injury that poses threat to life or bodily function. Yes, it is a condition that poses a serious threat to life or bodily function. And that's why I would also agree with you. It is going to be option T. Okay, now let's move on to the next element, that is amount of complexity of data reviewed or analyzed. So this includes your lab test, your order of the different tests, not only lab, the test which has been ordered, all the tests, review of the test. It can include the data obtained from the independent historian, previous results, all those kind of things. Okay, so again you have a lot of definitions to read from amount and complexity of data to be reviewed, and this is the four levels under the data. Okay, so let's go ahead and let's do some scenarios. Select amount and complexity, amount and or complexity of the data reviewed and analyzed. Option A minimal, option B limited, option C moderate, option D high. A 70-year-old established patient presents with worsening of shortness of breath. Physician reviews the hospital discharge record from outside cardiologist, orders BNP testing, CBC, and chest X-ray. All right, coders. Which level would you select under data for this scenario? Okay, so your time begins now, and you can place your answer in the chat. Okay, sorry, I will have to stop the clock because we have few more contents to cover. Okay, so far I can see great answers. Good job. Yes, it is going to be C moderate level because let's review the moderate level data. So for qualification or to qualify as a moderate in a moderate level data, you need to satisfy one of the below category, either category 1, category 2, or category 3. All right, any one is enough. Now we have a order of BNP, CBC, and chest X-ray. So that's three orders, right? So that qualifies for 3 points under category 1. Also, it includes a review of hospital discharge records from outside cardiology. So that also qualifies for a prior external notes from each unique source. So total, all the 4 points, there are 4 points under category 1. So definitely with that, I can say it qualifies for a moderate level data. Okay. So are you all with me, coders? Let me know in the chat. So with that, we will move on to the next one. Oops. Okay. Next one, coders. I hope you haven't seen the answer. Select the amount and complexity of the data reviewed and analyzed. A 76-year-old patient with a chronic heart failure presents with worsening edema and confusion. During the visit, physician reviews the CT scan results, orders repeat kidney function testing and CBC, discuss the management directly with the patient's cardiologist. Okay, place your best answers in the chat. Okay, Cody. So far, so good, great answer. So let us solve this one together. Okay, and yes, the correct answer is going to be option D, high. So why? Let's see. So to qualify for a high level data, you need to satisfy two of the below categories. So there are category one, two, three, and let's see. We have a order of a kidney function test, a CBC, and also review of CT scan. So that's 3 point under category one, right? 2 points under the ordering of each unique test and 1 point under review of the results of each unique test. So totally 3 points. So that qualifies for category one there, or that satisfies category one. Now we have a discussion of management directly with the patient's cardiologist. And if you read the category three description, yes, it fits in the discussion of the management of test or test interpretation with the external MT, qualified healthcare professional or appropriate source. So you have category 1 satisfied and category 3 as well, which makes option D as the correct answer. Okay, so I hope it's clear. The data is clear. Now we are moving on to the risk. So risk is measured based on physician's determination of patient probability of becoming ill or diseased or having complication or by dying between this encounter and next planned encounter. So that's risk. Once again, risk also have a few definitions under it. Please make sure you read them, and these are the four levels under the risk column. Okay, so you have minimal risk, which means when the provider doesn't do much or do anything, or recommends a home, recommends to stay pay us or recommends or asks the patient to stay at home, take rest. Those kind of things comes on a minimal risk. Now you have a low risk where maybe the provider provides or gives OTC, over the counter drugs. Now in the moderate risk you have prescription drug management, decision regarding minor surgery with identified patient or procedure risk, decision regarding elective major surgery without identified patient risk or patient or procedure risk factor, and diagnosis or treatment significantly limited by social determinants of health. And you have high level risk as well. And again, on the high level, also there are few examples given. Okay, now this is your CBT risk column. Let's do a scenario from the risk part, and let's try to identify the risk of complication, level of the risk of complication and morbidity or mortality of the patient management. Now, a 45-year-old diabetic patient presents with worsening blood glucose control. Physician determines a patient has been unable to afford medication consistently due to financial hardship and modifies the treatment plan accordingly. Select the risk this scenario. Alright, Codis, please your answers quickly in the chat. Okay, great answers by the way. Great answers in the chat so far. Yes, this one is a moderate risk because why? If you read the scenario carefully, you can see that patient has been unable to afford medication consistently due to financial hardship, right? So that falls under this bullet point. Diagnosis, treatment, significantly limited by social determinants of health. Okay, so great job, Kodas. Let's move on to the next one. Select the risk of complication and morbidity or mortality of the patient management. Option A, minimal, option B, low, option C, moderate, option D, high. A 67-year-old patient with atrial fibrillation presents for follow-up while receiving warfarin therapy. Patient reviews INR laboratory monitoring results and adjusts anticoagulation dose due to elevated bleeding risk. Continued frequent laboratory monitoring and is required to assess the patient assess for medication toxicity. Okay, Kodas, place your answers in the chat. Okay, all right, Kodas, go ahead, place your answers in the chat. Okay, let it be wrong. Don't worry. Give your best answers. So this one qualifies for a high risk. Do you know why? It qualifies for a drug therapy requiring intensive monitoring for toxicity. Yes, there was a continued frequent laboratory monitoring required to access the medication toxicity, and the patient was receiving uh, warfarin therapy, right? Yes, that's why it qualifies for a high risk. So great job so far. You all have done a great job in identifying the problem, the level of the problem, data, and risk. Now let's go ahead and let's apply to a scenario. Okay, and let's find the ENM level using a total MDM table. So here we go. Here is your scenario. What is the correct CPT code for this encounter? Option A 99212, 99213, 99214, 99215. An established patient presents to the physician's office with complaints of sore throat persisting for past week. The patient was previously seen by same physician within past 3 years for routine medical care. The physician performs medically appropriate history, comprehensive physical examination, including assessment of vital signs, general appearance, heart, lungs, abdomen, and extremities. Using a tongue depressor, physician inspects the throat, including the tonsils, posterior pharyngeal wall, oropharynx, and uvula. Examination reveals pharyngeal inflammation. A throat swab is obtained and later returns positive for streptococcal pharyngitis. Physician prescribes amoxicillin and provides instruction regarding medication use and follow-up care. Encounter involve low-level medical decision making. Okay. All right, Chorus. I think you can ignore those last line. Encounter ignore low level medical decision making. It's not there. Okay. Now you have to identify the correct ENM code. It's not low level medical decision making. So go ahead and place your answers in the chat. Okay. I once again I'm saying ignore the last line which states that the encounter involves low level medical decision making. All right, Coda. So great answers. And let's go ahead. So let's try to solve this one. So medically appropriate history and exam was performed. Yes, it's an office visit. It's an established patient as well. Time is not documented. So ignoring the last portion of the question, so we have to inventory the MDM and then score. Okay, so we have here a patient with streptococcal pharyngitis and procedure performed. We have a throat swab taken and a amoxicillin prescription was also given. Okay, so let me pull up my PDR chart and let me show you how I solve this one. So in the problem column, where would you place a streptococcal pharyngitis? Let me know in the chat code. Just quickly let me know. Where would you place a streptococcal pharyngitis in the problem column? Will it be a straightforward, low, moderate, or a high problem? Quickly. Okay, I'm just waiting for your response. Give your best shot, by the way. Don't worry, even if you get it wrong. And from what I see, most of you got the answer correct, so that won't be a big problem. Give your best answer. Okay, great. Anyone else? All right. Yes. Great answer. Yes, I would place it as a low because it's an acute, it's a streptococcal pharyngitis, right? That's a bacterial pharyngitis. If it was a normal sore throat or an acute, maybe we might go for a straightforward. Also, checking at the management, I can see there was a amoxicillin prescription given, right? So definitely this is going to be a acute uncomplicated illness or injury. I would take it under acute uncomplicated illness. Now, data, there's only one test performed, that is throat swab. So that would be qualified for a straight for a minimal or no data. So that's a minimal data. Now, risk. We have a moxicillin prescription given that qualifies for a moderate level risk. Now, we don't have a match here, right? In PDR, we have a low level problem, we have a straightforward data, and a moderate level risk. So if it's not a match, what are we going to do? We will throw the lowest level out and select the next highest level. And the lowest level here is straightforward. So we throw out that and select the next one, which is a low level ENM. Okay, and the CPT code for an established patient low level ENM is going to be 99213, option B, as most of you have said. Okay, so did the explanation help? Let us know in the chat. Okay, I think we will go for one more scenarios. Okay, there you go, second one. What is the correct CPT code for this encounter? Option A 99212, option B 99213, option C 99214, option D 99215. A 59-year-old established male patient presents for follow-up of type 2 diabetes mellitus diagnosed 12 years ago. Over the past month, he has experienced increased thirst, frequent urination, and fatigue. Home blood glucose reading have consistently ranged between 250 to 320 mg per dl. Despite compliance with his current medication, latest HbA1c reveals a level of 10.2% increase from 7.4% 6 months ago. Physician determines that the patient diabetes is poorly controlled and adjusts the medication regimen by initiating insulin therapy and adding a empagliflozin. Empagliflozin. What is the correct CPT code for this ENM CPT code for this encounter? Okay, Kodas, please your best answers in the chat. Okay, so great answers, great try. Let's go ahead and let's solve this one together. So in inventory, we have a patient with poorly controlled diabetes mellitus, right? Yes, it's clearly documented that patient's diabetes is poorly controlled. And procedure, we have an HbA1c that was taken, and insulin therapy, and a medication change was also done, right? There was a medication that is added, as well as insulin also was added. Okay, so where would you fix or where would you place a poorly controlled type 2 diabetes mellitus in the problem column? Type your answers in the chat, Curtis. Yes, it would be a chronic illness with exacerbation, right? Poorly controlled means uncontrolled, right? Yes, that would be a that would be a chronic problem with exacerbation, which would qualify for a moderate level problem. And in the data, we have only one test, that is HbA1c. So just one test reviewed 1 point, I would give a minimal level data. And risk, once again, we have a medication drug management perform, which qualifies for a moderate level risk. So again, we don't have a match between problem data and risk. So we'll throw the lowest level out and select the next highest level, which would be a moderate level ENM, and that qualifies for 99214, right? Okay, Codus, let me know in the chat. How are you all doing? Quickly, let me know in the chat. Did the explanation help? Are we good? Okay, I'll wait for your response. Okay, chat is silent. Please do let me know. Otherwise, maybe it's a small delay in my end. Please let me know, Chorus. Okay, I can see the chat now. Okay, thank you for letting me know. So I had few more scenarios to cover, but unfortunately, it is time, and I don't want you all to stay beyond the scheduled time. So I hope the session helped. And if you need more practice or if you want to rewatch this session, you can always find them in our catalog. Yes, our AMCI. If you go to our AMCI channel, you will find our catalog over there, which is CPT Guideline Mastery, and it will be there. It will be inside that session, and you will find a lot of other videos as well. Sorry. So please go ahead and check out the remaining videos, the rest of the videos also over there. And once again, I'm requesting you all to please take a moment to fill out that survey form. I've placed it in the chat, and also you can let us know the topics. I've seen all your recommendation, all your requests, and all your feedbacks as well. So please continue, and you can continue to let me know which video or which lecture would you like to have in the upcoming session. Your feedback is extremely important because only when you share it with us we are able to come back with more sessions and videos tailored for your needs. So please take a moment, a minute to let us know your thought. The feedback form is in the link. Sorry, feedback link form link is in the chat. Okay, and if you enjoyed the video, also don't forget to smash that like button, subscribe, and share it with someone who need to see this. All right. Okay, cool. So, uh, we'll be back. I think we'll be having a short break now, and after that, maybe we'll be back with a few more sessions, and you can let us know which topic are you looking forward to, so that once we open our third semester, we can bring the topics which you're requesting. Okay. All right, Coders. Thank you, Miss Mills. Thank you, Miss Diary. Thank you, everyone who else are there. Okay, thank you, Miss Catherine. Thank you, everyone. Thank you, Coders, for joining with us. See you all next session. Till then, stay safe and keep coding.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around.